Officials do expect coronavirus to come back once again later this year as the weather gets colder. And you've probably heard about this second wave that we've been talking about. It could hit during flu season. So here to talk more about it is infectious disease expert Tom Moorcroft. Good morning, Dr. Moorcroft.
Good morning. Thanks for having me.
Absolutely. So tell us, what exactly do health officials mean when we say this second wave, and how serious will it be?
Yeah, so the second wave is we're expecting a seasonal variation, which essentially means hopefully during the summer, the number of infections in the United States will decrease. But as we return to the cooler, drier temperatures of the fall, we'll see the virus reemerge. So they're calling that second wave. And really the biggest concern is we're not sure how much the virus may have mutated by that time, and if people who've already been infected will have any immunity coming up next fall.
All right. So how dangerous would it be to add coronavirus into the mix during, say, regular flu season, which is what we're talking about?
Right. Yeah, I think that's a big concern. During a typical flu season, our medical system is already challenged. During severe flu seasons, it's really on the brink of bursting at the seams, if you will. So if you take that typical flu season and put, anything close to what we've already seen with COVID-19 this year, that would be at least a doubling of what we're used to expecting. And that would be a place where our medical system could easily be overwhelmed, and we would expect to potentially see even worse outcomes than we've seen even this year.
So, for years, many of us have gotten a flu shot to fight against getting the flu. A vaccine for coronavirus is expected to be, a year or two out? So what can people do now to prepare for a possible second wave?
Yeah, I think it's good to understand that we have two main components of this viral infection, the virus and the host, which is us. So let the doctors and scientists do the work on the virus. And what we've learned from this is it disproportionately affects those with pre-existing conditions. But the good news about that is a lot of those are things that we can actually modify at home. So in addition to all the personal hygiene practices and social distancing, I'm recommending that everybody start taking action over the things they have control over, which is stopping smoking and vaping, engage in regular exercise so you can get back to closer to your ideal body weight, get 7 or 8 hours of sleep every night, and then get outside, get some fresh air and some sunshine when you can, and certainly take some time to relax every day. And these are things you can do at home that'll get you prepared not only now, but also for the fall.
Quickly, you talk of 3 ways to attack this: herd immunity, vaccines, and then treatments, right?
Yeah, so herd immunity is basically when enough of us in the population get exposed to the virus and develop an immune reaction to it, that it essentially sort of dies off in the population. And we would need at least 60% of people, if not 70 or 80%, to be exposed to COVID-19 and then also maintain immunity for that to work. Another way to get immunity would be to develop a vaccination that if we would stimulate the body to make antibodies and remember what COVID-19 is, so if we were exposed, we would not get sick, or at least not get as sick. In reality, 12 to 18 months is a really quick turnaround. It's usually, 5 to 6 years is usually a quick turnaround. So we'll have to see how that goes. And with treatments, it's very much like the vaccine. It usually takes a lot of time to develop medical treatments. Many are in trial right now, but what we've seen is differing results. So if you look at hydroxychloroquine, initially it looked very promising. There's newer research that shows it may not be as promising as we had thought. So we can't rush the process by skipping steps that ensure safety and efficacy. But at the same time, researchers and scientists have to get out there, and we need to innovate clinically because we need to help save lives at the moment.
Absolutely. And very quickly, we've heard the governor and the mayor talk so much about testing and tracing. How important is that in fighting the second wave?
So testing, I think, is extremely important because we don't really understand how widespread the infection is. As you've already been talking about this morning, the numbers, the estimates of who's had this virus are getting more and more every day. And when we know how widespread the virus is through our PCR testing and our antibody testing, it helps us determine where our resources should be deployed. But it also helps us understand where we need to engage in more sort of strict social distancing and even sheltering at home measures, and where we can maybe use some less severe measures. Over time, better testing will help us understand more about how the virus travels through our communities and if that herd immunity is occurring, and that could be really helpful in getting us back to life as we used to know it.
Right. Boy, that will be the day, right? Dr. Moorcroft, thank you for taking some time to
Right.
talk with us today. We do appreciate it.
Thanks for having me.